Little and inappropriate training with crisis situations, inadequate mental health services and an absence of hope. A picture of immigration detention as a strained and under-resourced system has emerged at a coronial inquest into the suicides of 3 detainees over a 10-week period last year. Fijian national Josefa Rauluni, Briton David Saunders and Iraqi man Ahmed al-Akabi took their own lives at Sydney's Villawood Detention Centre. The New South Wales coroner wrapped up hearings into the deaths today, with interest settling on the relationship between the private detention centre operator Serco and the Immigration Department. Karen Barlow has this report. The producer is Alison McClymont.
3 men killed themselves within a 10-week period last year at Sydney's Villawood Immigration Detention Centre. Josefa Rauluni, Ahmed al-Akabi and David Saunders. Different lives, different reasons for being in detention. The question is whether the immigration detention system failed them. Sydney's Fijian community was in mourning in September last year. The day he was due to be deported to Fiji, Josefa Rauluni killed himself after a 1.5-hour standoff with staff from Villawood's private operators, Serco.
In all my years' experience, I had never known action like that taken by Mr. Rauluni.
The 36-year-old was desperate not to return to Fiji. He believed he faced jail and torture there. In a damning report submitted to the inquest, forensic psychiatrist Michael Diamond painted a picture of Mr. Rauluni standing on a balcony railing, surrounded by overly confronting and aggressive guards, none trained to deal with serious threats of self-harm. They were shouting at him,
"One way or another, you are going to the airport. The boys are going to come and get you."
No one present at the site had the skills to correctly interpret the behaviour of the subject as he stepped on and off the balcony railing.
There were no trained negotiators present, and the Serco manager at Villawood admitted to the inquest that some of the officers had not completed Australian accredited training. Serco self-reports the training levels of officers, and the immigration official in charge of the Serco contract, William McInnes, said in evidence he assumed Serco officers all had Australian qualifications. Serco's use of officers without accredited training puts it in breach of its contract with the Immigration Department.
It would cause me some concern.
Dr Michael Diamond, an expert in high-risk negotiation techniques, said that not only could Josefa Rauluni's death been prevented, staff escalated the situation.
The overriding concern was about time constraint, that Mr. Rauluni should not miss the 1 p.m. flight from Sydney to Fiji that day.
No one knew who was in charge.
Different orders were communicated. There was no plan, there was no order.
Serco says it's now added new removal procedures to deal with difficult, life-threatening removals or transfers.
Dr Diamond's report found that a lack of a coordinated response between Serco and the Immigration Department was a standout in the tragic events that led to the death of Josefa Rauluni. He says it led to the dismissal of hope. When examining the suicide of Iraqi man Ahmed al-Akabi, it was Villawood's mental health services that came under attack at the inquest.
The Psychological Support Program, or PSP, was specifically devised by the Immigration Department for the prevention of self-harm in detention. The inquest heard that inadequate resourcing meant that it was not available in November last year when Mr al-Akabi hanged himself at Villawood.
It was developed in April 2009 but had not yet been implemented at either Christmas Island or at the Villawood Immigration Detention Centre at the time.
Reviewing the case, psychiatrist Suresh Sundram found that Ahmed al-Akabi was likely suffering an undiagnosed major depressive disorder in the months leading up to his death. Professor Sundram says Mr al-Akabi fell through cracks in the system. He says he was not screened, medicated, nor followed up properly by visiting mental health officials.
The mental health team didn't have the capacity or the structure to be able to outreach into the detention compound, namely that is to identify people at risk and to be able to actively engage and seek them out.
Serco says the 3 deaths are tragic and that since the deaths it's made changes to staff training, policies and procedures. And it says a staff member with specialist crisis negotiation and management skills is now on site at Villawood at all times. The coroner's findings on the 3 deaths is expected by the end of the year. Karen Barlow, Lateline.